just want to teach them. Okay. So we are starting IPT. We already have mixed the chemo in the morning, and we have started the chemo. So the chemo has to be going, and it has to be going at a reasonable rate. And I don't know if it is reasonable rate or not, but it doesn't look like it's going as much anymore. But it needs to be going, okay, at a reasonable rate. Okay, and at the same time, we're going to now give her the insulin. We have calculated the dose of the insulin. Before we do that, you have to make sure we do an AccuCheck. So, could you go get the AccuCheck stuff? Do you know where it's at? Yeah. Okay. So, okay, when we do the insulin, just leave it. So we have the AccuCheck. Here's the insulin. You're gonna drop it with the Pepsid for now, and we're gonna show you where to put it in. So we have here 7 units. That's what the dose we have calculated for her. And what we do is, first of all, you have this ready, which is the insulin ready, and you put it with here. And now what you do is you check her this, and you know what her blood sugar is to begin with. All right, and when you do that, you twist this to get it, and then you go in her finger, that and it's dry, and you go 1, 2, 3, and then you stick her, and then you get that out. You put one of these strips in. You have to put the strip in and wait until you see the drop. You have to see the drop coming. There is a drop that once the drop is in, you're ready to go. And it gives you a beep. Then you go here, and now you know how much that is. All right? And it will give you her sugar is 106. You have to document the time. You write it down and how much. Then you give her something to keep the alcohol on so that we can use it again. Now you go here on the blue part, and we wipe it again with alcohol to make sure that we're good. And then you give her that insulin here. You go in here, you push the insulin in, and you open the line. Okay? All right, that line is open and the fluid is going. What is happening here? Why is the you have to be able to have fluid running. All right. Okay, so 10 minutes later, all right, where if you're not getting fluid, you need to see why. So what we need to do is get a flush. You go get a flush to make sure we get it going. Get us a lot of flush. Oh, here we have flush. Come on. Thank you, my dear. Stephanie? So we're flushing. Stephanie?
Here we are.
We're flushing.
Is this the right sheet?
Yeah, it's fine. Just we're flushing everything to make sure that we're able to get the fluid in, the insulin in, to make sure everything is going in, to make sure why is it not flowing. So we'll see if it's gonna start flowing again. Okay, we just, why is it not flushing? Did it flush this morning?
Mm-hmm.
Oh, Is it dripping now? Yes. So we flushed it, it is dripping. 10 minutes later, you check her blood sugar. Her blood sugar need to be 60 before you start pushing all these drugs. Okay, so Olga, just pause it.